I'm curious about about how primary care utilizes the add-on therapies after, I mean, they're well-versed, I think, in use of statins. But what about ezetimibe and the PCSK9 inhibitors? I know for the latter, there's certainly an insurance, still probably an insurance barrier. But are primary care physicians paying attention to the next steps after statins?
That's a great question. I would say part of often primary care practitioners, physicians do see the issue and do frankly want to start a PCSK9 inhibitor, and they tend to defer to cardiology, and maybe cardiology doesn't do it as much as we should. So what my suggestion is to the primary care providers is that they take the bull by the horn and they prescribe the PCSK9 inhibitor. And fight the insurance companies just like cardiologists do, and they'll win. You know, these drugs fell 60% a couple of years ago, so we have access to them now. We just need to prescribe, and you know, from a prevention standpoint, we also have drugs for diabetes, the SGLT2 inhibitors, GLP-1 receptor agonists that now have cardiovascular indications. So that's another area of prevention that primary care practitioners could be more involved in. I think to leave the prescribing of those drugs to the endocrinologist or to the cardiologist, frankly, is a mistake. I think the primary care practitioners should be the ones they're on the front line. They're seeing these patients all the time, and they need to prescribe these drugs, even if they get some pushback, frankly, from cardiology and endo. They need to prescribe them when they're indicated. Best of all possible worlds, of course, is to work in a collaborative, collegial fashion, and to speak to the cardiologist and speak to the endocrinologist. But sometimes, it's hard to connect to these people, to other practitioners. And the patient needs to come first. So I think that the PCPs, if they could address that, if they could prescribe the SGLT2s, the GLP-1s, if they could prescribe the PCSK9 inhibitors and ezetimibe, I think it would make an enormous change in prevention. I'd like to emphasize one other thing, though, and that's therapeutic lifestyle changes. These are the things that are tending to fall apart now with COVID. The exercise, the diet, stress reduction. That too can be emphasized from a PCP standpoint. I know it sounds like I'm putting a whole burden on the PCPs, but they are the front lines. You guys are the front lines, and it would be really helpful if you did this, even if you got pushback